Good morning. Thank you for joining us today for the 44th meeting of the Board of Lake County Commissioners. Would all of those who are willing and able please rise and join me in the Pledge of Allegiance to the flag of our country. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Amen.
Grant us, O Lord, light to our understanding, prudence in our investigating, foresight in our planning, sincerity in our deliberating, the grace to follow truth in our judgment. Help us to be moved in our decision, neither by fear nor by self-interest, and to do our work faithfully. May we respect the authority vested in us, for thou art the source of all authority, and may we use it in our directives for the common good and for thy honor and glory. Amen.
Amen.
Thank you. Madam Clerk, roll call, please.
Commissioner Serino.
Here.
Commissioner Young.
Here.
Commissioner Hammercheck.
Here. Okay, this brings us to our first public comment. We have with us today Ron Graham, Lake County General Health District Commissioner. Ron, would you like to dive in and give us sort of a state of the county and some suggestions and recommendations from your perspective, sir?
Yes, thank you for the opportunity, Commissioners. Appreciate that. And thank you for your advocacy for House Bill 404, which allows public meetings to continue to be virtual until July 1st. Very, very grateful for that.
Volume okay.
Just wanted to give a recap to the Commissioners and the community about the status of our numbers. As you know, we have 3 or 4 of the highest zip codes in the state. Prior to that, 2 weeks ago, we had some of the best numbers in the state. And that really shows you that how fast this can move, and that it's, our mind is community spread at its pure definition. We're not finding any outbreaks, and an outbreak can be considered 2 or more individuals. With very minimal outbreaks among our nursing homes or congregate living, among our businesses, retail stores. We're just seeing a very sustained and broad spread community spread with this disease, unfortunately. So there's nothing we can point at to say this is a true problem. It's good and bad in both ways. A little bit about the movement of the numbers. October 18th, we had 60.
Mike, can you increase the volume? I'm getting.
I have. November 2nd, 75,000 cases. November 12th, 263 cases. November 16th, 280. And as of yesterday, we were back down to 200. Our early projections locally with the Lake House Hospital System, we've got projecting 2 weeks out, thinks that this may in fact be the peak, which would be great news. Some other scenarios that plan out a bit further than 2 weeks. I do anticipate our numbers could still build between now and the end of the year. But we're not going to be pushing information that we can't confirm or feel 100% validated for. So we're just going to keep watching these numbers. We led a charge at the state to reduce the amount of contact tracing that we do. Rather, we will be moving to what we call the index case, which is any of the lab or physician reported cases. Contact tracing beyond them will kind of fall to the employer, the school district, or the individual themselves. And we will be converting our team over to do more targeted business consulting, basically guidance, so that when these positives occur, we can preserve the infrastructure of the facility, the school district, or the classroom, or the business, because that's where we're at. For an example, when we had 280 cases, each of those cases would take 20 minutes to investigate the index case. Each index case would average another 10 contacts that would need to be called, interviewed. And if each of those calls were at 10 minutes, we would need 164 individuals working an 8-hour day to keep up with the contact tracing. So public health has to kind of adjust, and we set that through the Health Department of Health. So our access will be much more targeted individual work, and just looking at those index cases and getting those in the system so that we can more accurately make decisions. The stay-at-home order, some are calling it, but really it's a curfew, is a bit concerning to us. I think may foster some additional angst and anxiety of the public. So some agencies are kind of rebranding that as a stay-at-home order. We're just trying to keep the education side up, working with employers rather than trying to create a bit more fear in everybody. The hospital capacity, at least with Lake Health, is around 56 beds with COVID patients, and 15 of those being in critical care, very minimum on a ventilator. Again, that number seems to change every day, certainly on the higher, but we're just going to have to wait a week to see if those convert to significant hospitalizations with our numbers that we're currently posting and/or fatalities. The severity of the disease seems to be a bit less, and there's some medical therapies that have been approved here coming up soon from treatment that we think will keep more people out of the hospital, which is great. Regionally and locally, medical staffing is more of the limiter than the capacity of the hospital from a physical structure. So what that means is beds are available, but it's stretching the nursing resources thin enough that there's some concern about staffing through all the healthcare systems here in Lake County and Cleveland. We're working diligently to work with our schools to keep them open as long as we can. Rather than a blanket closure that's being recommended, we are trying to do it case by case. We may be able to keep K through 5 classes open a little bit longer, but for the most part, schools are looking at a definite break between Thanksgiving and January 15th, probably larger than usual from a remote standpoint, to regroup and come up with a plan, because they are also having staffing shortages. So we're trying to be as supportive as we can to keep business as usual and reiterate mask usage, telecommunications, telemedicine, anything we can do to minimize that, with a general statement of try to keep your holidays small. Don't interact with new cohorts of people that you're not used to being around, including extended family, which is very challenging. Concerns we have are just the college students coming back home for the holidays, from travel, proximity, and social distancing issues are also usually not as well maintained. And it's unfortunate we have to do that, but I think if we can buckle down and do that, we can get through these numbers pretty easily. Again, our concern is hospital capacity and severity of the disease, requiring hospitalizations and or ventilators or fatalities. So right now we're pretty saturated, but we're doing pretty well as far as the complexity of complications related to those cases. At this point, I'll just turn it over to the commissioners or anyone that has any questions for us here at the Health District.
I do have a quick question.
Yes, sir.
You mentioned that the infection rate was 260 some a week a little while back, or 1 week, like 260 something. Then it went down to 200. That's quite a drop, which is great. But anything you can attribute that to, or?
No, again, so yeah, one single day we had 268 cases. As of yesterday, we had 200. And that's the complex thing. So we went through about 400 cases in a single day, putting some staff on Saturday and Sunday overtime to look at that crystal ball. And it has hit pretty much every workforce, every age group, every demographic, without any prejudice. So it really is ultimately the community spread. We're not finding it does outbreaks to restaurants or, athletic events. It's really what is happening beyond those hours of school, work, and other typical places where you have a defined structure that you can work with. It's just really those outside extracurricular activities, the social activities that are continuing to look like the leading cause of these increasing cases.
When it comes to severity of cases and numbers of cases, how is it treating 12-year-olds and under, the kids?
Primarily, the data we have right now is often asymptomatic, so there's a good group that we don't even know about. The other ones are presenting like a sniffly nose, very minimal and very typical allergic or seasonal allergies or common cold symptoms. And as far as I know, none of those individuals are getting to the hospital in the younger age groups. Again, the average age of, as it was 2 days ago, average age was 71 of the hospitalizations here for Lake County.
Okay. All righty. Well, that's my questions for now. Thank you, Ron. Good job.
Ron,
Again, thank you. Anything from the other commissioners?
Ron Graham, this is John Hammercheck. Can you hear me okay?
Yes, hello. Good morning, Commissioner.
Okay. In the interest of just informing the community, which is very important, obviously, community spread. when we first started November, we had 4 hospitalizations with Lake Health. We're now well into the 60s. Is that a reasonable?
Correct.
So the indicators, we've had some peaks before, but it's fair to say that it's different now. We're starting to see higher positivity rates. Those positivity rates are starting to result with hospitalizations. That's a change from what we've seen previous, correct?
Yes, yeah. The positivity rate varies anywhere from 8% to 25% according to the population. So if you look at those coming into the hospital for pre-op, those are much closer to 25%. General population is still around 6 to 8%, best we can tell with the current numbers that are becoming a bit delayed because of lab capacity and statistical capacity from some of the partners.
Now, one of the things in our region, we're very fortunate in regards to we can do testing. Other parts of the state, they're having some challenges getting testing materials. So numbers alone do not tell the whole story. Right. But the indicator is we have more people in the hospital. The hospital stays are shortening. We know that the data is showing what originally we were seeing 14 days, we're now down to about 5. Can you comment on that a little bit for us to help educate the public? I believe it has to do with the new therapies, and they're gaining field experience with being able to process people and get them the best possible care right up front, is where I'm going with that.
Yeah, it's a little bit hard to hear you, Commissioner.
Oh, sorry.
I think, what you said is the hospital stays are decreasing. That's correct. The severity of the disease is lessening. And those are all great indicators. As we move ahead, we're comparing to vaccination clinics as that comes down and really trying to bridge between now and the vaccine, which is really quite a bit of a moving target. Again, we wanted to urge individuals, if you do go out, please wear a mask, be conscientious of hand washing and those other social distancing, and we will get through this just fine.
And Ron, I'll speak up a little bit more on the education side of things. Again, community spread, that means there's not a point source, not a single event, a single location that is a high contributor. With that said, we have examples of, in fact, I'm thinking of someone who was in the hospital in Cleveland, contracted COVID while in the hospital from their doctor. But since that person lives in Lake County, they would show against the Lake County numbers. So it's not saying that Mentor, Willoughby, Painesville, that they're doing anything necessarily wrong. They could be traveling out of Lake County to go work. So personal precautions. I think you mentioned hand sanitizing, good attention to detail. Are those some of the things that we could do to slow this and to stem the tide a bit? Could you comment on that, please, sir?
Yeah, so if I heard you correctly, that individuals that are tested in the hospital in Cuyahoga County, for example, would be counted if they live in Lake County as a positive. The basic prevention cautions that we've had before, those preventive measures are still intact. Additionally, we just need to reiterate that and everybody pull together, and we should see these numbers really stabilize or retreat over time. Again, we want people to seriously consider having a discussion with their family to make sure that the influenza, seasonal flu shot, as well as when the clinic starts for the COVID-19 vaccination. That is the one thing that could throw this for a loop, is if we have low vaccine acceptance rate, we could certainly be struggling with this disease much longer than we would want to. And so there's always a lot of concern about vaccinations. Our goal is to really begin a heavy education to get a high acceptance rate of the vaccine and really push those numbers down so we can get back to business here as usual in Lake County.
And Ron, if we could just comment a little bit on our medical providers. It's safe to say that everything from our EMS crews handling each patient as if they're COVID positive. There's a fairly high burn rate on PPEs, decontaminating emergency apparatus afterwards. Our hospitals themselves, bed space is being consumed. I think it's fair that the public should be made aware that recently Lake Health had to be diverting patients to other hospitals. Is it fair to say that those are all important things that the public should be made aware of?
Yes, so if I caught you right, the The EMA is a nice stockpile of personal protective equipment for the hospitals and the nursing, assisted living, all that coming from the federal government. Using those precautions that the fire and police have really stepped up their awareness and dedication to preventing the spread. Early on, we talked about it this summer. We talked about it each week. We get together with the fire chiefs, the schools, every community partner that we can to make sure we're all on the same page and monitor not only the burn rate, but compliance to the protocols. So we've made a lot of proactive decisions among fire and police to keep that infrastructure in place. We do have some testing kits we acquired from the health district, which is a PCR test, or the school standard for testing, that we are training on right now, our staff, so that we can help test asymptomatic infrastructure staff that are currently not able to be tested in most cases in Lake County, to preserve that infrastructure and keep things moving in the right direction.
Now, Ron, I'm turning to you more as a health expert, as our health commissioner. The seriousness of taking this, I realize there's a high degree of fatigue. I think they're even calling it COVID fatigue at this point, where people are just getting tired. But that doesn't mean that we can't do simple things like continuing with the hand washing, maintaining personal discipline, not getting in people's faces when we're communicating. Simple things like that. Is that reasonable? That's something that you're starting to see more occurrences of?
Yeah, we're seeing that the higher compliance with face masks, because this disease spreads in the community and hits some of your families on a personal level, or kind of a life-changing event if, God forbid, a fatality happens. Yeah, we could continue with those social distancing, the mask use, not going to work or school when you're sick. At that point, if there is any trend, we are seeing that trend where parents and families and employees are hesitant to acknowledge that they have potentially have COVID or domestic testing and go to work with symptoms, and then 2 days later they find out that the symptoms have worsened and they're in the hospital or getting tested positive. That is probably the one thing is in the lead that we've identified so far, is that reluctance to keep your child or yourself home when someone's sick. So I think that is really the one we need to focus on the most currently.
Now, on the education side, since that's really something that we need to seem to, if I can use the term, double down on. Let's really get serious about this even more than we already have. What more can we do? I know you have an active website. Is there more that you could put on there? Is there more that we, at the county, we can push out to the mayors and managers, to our municipalities? I know we've been doing that, but what more can we do?
Those kind of concepts, and we're also looking at some of the other states that are kind of in the lead with the infections to see what additional information we can have, but we will be adding that this week as we, like I said, we transition to more self-guidance among employers to treat the employees and those protocols. We'll definitely have that information out and try and come up with some new strategies that are not cumbersome to business and productivity, to keep everybody have everything they need available to them and keep the workforce strong, so that we can protect the hospitals as well as our community.
Okay, and I know that we as a board, we're going to be coming out with some new protocols. We're going to be going back to some precautions that'll be announced here shortly. Ron, what would you recommend for our businesses? Do you have some short, sweet, simple things you can just re-emphasize? I don't think there's anything new per se, but I think maybe some discipline as far as our retail, as far as our manufacturing. What words of advice could you offer?
Anytime we can increase the quality of the mask usage or increase the frequency of compliance to that, there's a lot of people with medical conditions that's contraindicated. The more they can help out with contact tracing or be a bit more conservative, separating individuals that may have symptoms, those are great. Increased sanitization is great procedures. There is a lot of fatigue, and 9 months later we probably don't adhere to the guidance and protocols as much as we would like. So we just have to put on a renewed emphasis on those core activities, and it really is about communication, so people feel comfortable identifying themselves as someone impacted by COVID or symptomatic, and getting those individuals to do the right thing.
And my final comment, if not statement, one of the things I heard you touch on, and this seems to be a pretty prevalent, people who are symptomatic and do not take action on it. What would you say to those folks? People who know that there's something not quite right, but they still expose others. What would you say to those folks?
That in the end is not only jeopardizing their family's safety, but it's really impacting the ability for that employer to continue to operate. And I don't think that anyone wants to jeopardize the business or the agency or organization that they work for. So it's really helping protect your job in the long run. And while it seems difficult and challenging with daycare and those items, we really need to keep the business sector in play. Income, loss of income is definitely a factor that can contribute to more spread. Changes in the family's routine that they're used to could cause them to be exposed to additional individuals that they're not used to. So again, that's really in their best interest to keep their employer healthy and strong, and take off 2 weeks if needed versus taking off a month if these cases go wild and really impact that employer to the point that they may have to shut down or lose staffing. So again, we want to keep the balance of common sense, preventive measures, business and health, and be as moderate as we can with all those factors, and not make any radical decisions that could push us either way along the curve of increased cases.
Very good. Commissioner Serino, Commissioner Young first.
Yes, I have some, Mr. President. Ron, do you have some extra time here? I have a number of questions.
Yes, I'll try to
Okay.
answer to my best of the
Okay,
ability.
and some of them have sort of been addressed already, but let me just go in the order that I have them here. First of all, there was a couple of references made to shortages in PPE. And I don't know how many, I haven't seen the numbers on how many squad calls there have been. I assume quite a few where PPE is consumed, certainly. But with the hospitalizations at a pretty reasonable number, given the fact that we've stockpiled, I thought, a lot of things. Are we in fact seeing a shortage of PPE in the county?
No, I'm sorry if I've miscommunicated that. So the EMA does have a great stockpile of PPE. So as I talked to the Emergency Management Agency, we continue to get drop shipments to the point that there's almost an excess. Odd things as far as shortages, maybe things like a surgical gown that typically comes in a size large, where it's more convenient for a smaller female that needs a smaller medium. There's some oddities like that are short, but primarily that's been pretty available to the point that at this time it'd be nice for employers to stock up on anything they can, because there could be potential shortages as we go down the road.
And
But right now, I think like health is certainly covered. The burn rate is reasonable, as well as any of the nursing homes. Joe Bush, your director of the EMA, has really did a great job of controlling that pipeline.
And Ron, this is John. Just briefly, I wanted to interject. The 1860 N95 fitted mask, those are very much in short supply, and we're not getting any from the state. We do have a request in for another 20,000 units that they've not been able to fulfill, and that was one that we were looking at alternate sources to procure that. Just to give you a little bit of background, that was one of the items that we were working on pretty diligently yesterday. So back to Commissioner Serino.
Okay, next question is on ER issues, and you touched on it briefly at the beginning. I'm getting a lot of calls and questions from people who are, and I want to make sure we explain exactly what the situation is here and avoid rumors that people are being diverted from nearby hospitals because Lake Health is not taking in patients into the ER. And so what is the diversion plan going on right now relative to ER treatment?
Yeah, that's typically, I can't speak too much on that. That's a hospital kind of capacity with Dino DeSanto. But the couple of the divergences that they have typically have occurred, a couple times a month in a typical seasonal flu. And I think the most recent divergence was more based on a sudden influx within the 4-hour period. So diverting those patient care was more about giving Lake Health the time to realign themselves and reposition staff and some of the physical structure to do that. Last I spoke with Lake Health, they're very confident that they're in a good place. Again, they're just monitoring their staffing to make sure we are as covered as we can here in Lake County.
Okay, so it is an occasional thing. It is not a diversionary plan that's in place right now that would last for a few days or a week. It's going to depend on the particular load on the ER on that given day. Is that correct?
Correct, yeah. I'm not aware of any, there's plans for diverting patients all the time, business
Right.
as usual for us, and I have not heard of any significant need for
Okay.
that currently. They're just, again, preparing for that, and the occasional window of diversion is not unique to Lake Health nor the other hospitals.
Right.
And they've been working together for years for that kind of planning.
Okay, so my second last question is, you mentioned contact tracing, that you're going to be changing the strategy regarding that. And so when you mentioned that you're going to be offloading or delegating the contact tracing to companies and organizations and so on, how are they trained to do contact tracing?
Yeah, unfortunately, that's what we need to put a team together, because that is basically something that's novel to this event for the most part, Commissioner. So we're putting a website up. We're transitioning this week to do that. And what we're doing is just making sure we get the data more timely on the front end. So if it takes, days to get back to somebody that's positive, we're not protecting the community if we can't get to these calls in 24 hours. So our interests are in looking at outbreaks and sources of transmission, and ultimately we get that through the primary index case. So what we're doing is putting a team together to help train large employers, and we'll have a website up with some state guidance that they can calculate quarantine periods, and then we'll be there for the support. So if they do struggle, we're able to work with that employer versus kind of working through all these individual contacts. We believe it's a much more efficient system. And this will be occurring in all 88 counties and with all 113 local health districts kind of transitioning this week and next.
Okay. And my last question is around a series of statistics. And I've gotten your latest report through November 18th, which was very helpful. And I bring up these questions not because I am not concerned about this whole situation. I certainly very much am. And I think all the commissioners take our responsibility, along with yours, for public health very, very seriously. And it's clearly is a contagion issue that we have to address. But I believe that the best way to address that is by informing people, educating people, and encouraging people to be careful and cautious, not by scaring people, which some people around the country are doing. They think that people need to be scared into doing something, into action, and I totally disagree with that situation here.
Yeah, we want to keep compliance through education and
Right.
informed consent.
Right.
Not fear.
So let me ask a couple of questions. Is it correct that the as a percent of positive cases that the hospitalization requirements, or let me just back it up, the ICU incidences are actually declining?
I'd have to look at those numbers, but I do think the ICU cases are slightly increased, but not overwhelmed past the surge capacity presently.
Well, if the ICUs are around 47 through the 18th of November, and we've had how many positive cases during that time? I would think that statistically that the percentage probability of going into ICU would be reduced.
Correct. Yeah, if you're not looking at physical count, but those number of new cases versus what was in the ICU, that percentage would decrease.
Yes. Okay. Now,
that is correct.
I also want to ask you about the death rate or the mortality rate, I should say, to be more particular. And again, the death rate, if you look at let me just ask you, what is, of the 230,000 people in Lake County right now, or roughly, what would you calculate as the mortality rate?
Right now, we're at 62 fatalities. This would be far less than 1% of what that rate looks like.
Right. And so it's a very low number on fatalities for the total population. If you look at it as a percentage of the people who have tested positive, do you have that number?
So testing has increased exponentially, and so have cases. They're kind of outpacing, but the most general number we have for the state and the region is around 8% positivity rate.
Right. So again, I'm asking these questions because I think in our communication, and again, we have to take this very seriously. Let no one doubt that, okay? But we also, again, we want to approach this as I think you are, doing a great job of communicating and educating and teaching people how to be careful and cautious and not make the problem worse. But we owe it to our public not to use scare tactics. And the actual fact is that unless you're living in aggregate living or congregate living and have a number of pre-existing conditions that would make you more liable to be to have a fatal result here, the chances of you actually dying of this disease are very, very small. That does not mean that we should not take caution and be careful. Absolutely, we should do all of those things, but we do no good by allowing people in the media particularly to use scare tactics to try to coerce people into doing things. We're not doing things, and we just need to share the facts with them. People should not be walking around scared to death. They should be walking around being careful and doing all the things that they are instructed to do to make sure that they don't spread this disease or that they get proper treatment if they contract it. But scare tactics are not part of public health policy, in my opinion, or shouldn't be.
Correct.
Certainly.
Yeah, we want to make sure people just have a good plan, a good understanding of the prevention measures, and take time to think out how that impacts them or their family or the employer. We will be enhancing our website to put much more of this data as we run through larger volumes, which tells a better tale of what we're seeing. But in your statement, the chances of you getting COVID-19, having a severe complication to the point that results in death is extremely low. In most cases, you're going to early medical treatment and self-care. You can recover at home. You can recover within 2 weeks. And certainly we're not seeing those individuals, all in the hospital as it was kind of portrayed at the beginning of this in summer, which was really kind of an overcompensation because it was an unprecedented pandemic, and we're just seeing a whole different story right now. So we need to be careful. It's very serious, as you mentioned, but we need to use the data. We need to work together to do this. And if you're in a fear kind of mode, we're going to make bad decisions.
Right, and we need to let people make responsible decisions. I believe most people are responsible. There's been a lot of talk and questions from constituents about Thanksgiving and even about Christmas, looking further ahead. And everybody needs to make their own choices about how they want to deal with this issue and traditional Thanksgiving. They should certainly avoid having a Gavin Newsom Thanksgiving party. That would be very irresponsible. And unfortunately, he is the governor of California is setting a terrible example and then proceeded to lie about the circumstances. So we want people to be honest, and we want people to be responsible. And I believe Lake County will turn this around before too long. Thank you, Mr. President.
Thank you, sir.
Absolutely.
Ron Young, did you have anything you wanted to add, sir? Okay, Ron Graham, just kind of a little administrative thing. You are the Lake County
John, excuse me, I had my phone on mute. I just want to say I think Jerry pretty well covered my line of questioning there.
Very good.
To announce that about 11:15 I have to break off. I have a very important meeting I have to run out to here.
Yes, sir. I'll tie this up in a nice, neat little package here. Ron Graham, again, you are the Health Commissioner for the Lake County General Health District. We are the Board of Lake County Commissioners. You are an independent body. You are the individual charged with the responsibility for the health district command and control, if you will. Could you maybe comment on that a bit? Because there seems to be a little bit of a educational misunderstanding in the public as to who has the authority here.
We are just certainly created an Ohio Revised Code as a standalone entity, meant to be pretty much singular and unbiased in our decision making. But with that said, we do work with everyone closely. But, you know, you do understand that we do not report directly to the commissioners here in Lake County. But again, we work together in this, during this event. We've been talking to every leadership, every safety force, every policy level decision maker that we can, and it's been a great partnership. And despite the numbers going up, we're going to continue to get through this. And again, it's time to be confident and be safe, and we're going to get through this together.
And on that note, from the beginning, the Health District, this Board of Commissioners, we worked very closely with Mayor Morley. Eastlake is the president of the mayors and managers, safety forces here in Lake County. There is a great deal of communication and effort that goes on behind the scenes that the general public does not see, but it is a truly coordinated effort, not only within Lake County, but with the state of Ohio. Is that a fair statement, sir?
Correct. Yeah, we have a great partnership here in Lake County, and I cannot thank everyone enough for, having these conversations, having them early, being realistic, and being part of the implementation collectively. It's an impressive thing to see, and again, no deficiencies that I'm aware of in any of our planning.
Very good, sir. Thank you for joining us today to help out. This is definitely, I know the word unprecedented is becoming overused, but definitely fits this discussion here today. So with that, sir, again, we thank you for your time, and we shall continue on, sir.
Yeah, thank you for your time, Commissioners. Appreciate it. And, reach out to anyone. We encourage the community to hit our website, contact us so that we can help explain any concerns or fears that they have. Thank you, and have a good day, gentlemen.
Bye, sir. Okay, moving on. Do we have any public comments? Jason Boyd, County Administrator, anything came in by email? Oh, okay, stand by. We have something.
Good morning, Commissioners. Yeah, we have a public comment submitted via email this morning from Patricia Denny, Mountain Quail Place, Concord, Ohio. I'll read this in for the record as our policy. Bed space and staffing in hospitals is dwindling and almost gone. Hospital personnel are suffering and under the worst stress they've ever experienced. Someone we know who managed to have a surgery for a serious condition in one of his main organs was sent home the same day from a hospital because they needed the bed. Lake County is now number 4 of 88 in terms of COVID cases per 100,000 in the entire state of Ohio in the spread per capita. It's hard to find this information on the county's website. It doesn't show up in the almost worthless press release on the Health District site that is confusing for most people to understand. I don't see Lake County's current state ranking of number 4 anywhere that is obvious to those who might want to visit the site. I think this is by design. The info should be front and center on the county's various websites, ! Other counties are advising people to stay within their own households for the coming winter holidays. We need to be doing the same and more in Lake County. I've witnessed too many people in this county, I think this is flaunting the mask and physical distance advice from medical experts. This is one of the reasons why we rank in the highest in the worst possible way. I've lost much respect for the people who are so unbelievably inconsiderate of their neighbors and who think business as usual is okay in a pandemic. End of comment.
Okay, the only thing I can add to that is I think our discussion previous addressed every statement or concern. The only thing I don't think was unaddressed is, that by design, I would say there is no effort to conceal any information. So that's the only thing I could add to it. Commissioner Serino, Commissioner Young, anything you want to add to that?
Mr. President, the only thing I would add is that I think as Jason read this, that I think this is by design is an insinuation that is inappropriate and is wrong. We communicate, we make great efforts along with the Health District to communicate all the information. It's out there, it's published in a number of areas, so I don't understand why that comment would be necessary. Thank you.
Now, the only mitigation that I will throw to that is we have, as a government body, we're all working with our mayors and managers. We are referring everything back to the Health District so that there's a single source, so that there's no dated information. If she was here, I would be having this conversation with her, but I think it's fair to say that we are doing it the right way, that you don't want to have 5 different cities with 5 different versions of information out there. So the fact that we're pointing back to the Health District, I believe I did hear Commissioner Graham, Health District Commissioner Graham, comment that they're continuing their efforts, refining and trying to adopt best practice, and where that best practice does not exist, create it. Jason, you look like you want to add to that?
Yeah, and if I may, I can do this now or later regarding kind of what we're looking at from a county operations
I
standpoint.
think now would be very timely.
Okay,
So thank you.
yeah, and I thank Ms. Denny for the public comment, but I think to confirm to the public, how serious we take this issue here in Lake County. I've been on the phone the past couple days with some elected officials and department heads, and based on some of the data, we're going to begin to, effective Monday, and there'll be a press release issued tomorrow, Friday. We're going to scale back public interaction within the county facilities. A couple exceptions would be our county court systems, the sheriff's office, and due to some revised code requirements, the county recorder. This will be similar to earlier in the year. Business will continue to be conducted at 100% as it was, with our series of drop boxes in the main vestibule that we have. Visitors by appointment are still permitted in the building, as we always have allowed, but based on guidance from the health commissioner, some other data from the health systems, we feel this is the right thing to do for the safety of not only our employees, but visitors to the county facility. So I will be issuing this press release on behalf of the board tomorrow, with an effective date of Monday at 8 a.m., where county facilities, excluding the courts, the sheriff, and the county recorder, the public interface will be very, very limited, with the exception of prearranged appointments. So once again, this is just a precautionary best management practice that I feel that we have done collectively with the commissioners and the other elected officials for the past 9 months. So thank you.
Thank you, Jason. Gentlemen, anything you want to add to that?
No, sir.
Very good. Jason, thank you. Any other comments? I'm assuming since you're walking away, the answer is no? Okay. And do we have anyone here in the audience wishing to address the board at this time? There seems to be no takers. With that, Madam Clerk, would you please go into the resolutions for us?
In the engineer's office, resolution authorizing the Lake County engineer to prepare and submit an application to the Ohio Public Works Commission State Capital Improvement and/or Local Transportation Improvement Programs, and to execute an OPWC agreement for the Bates Road Reconstruction Project in Madison Township.
Move to adopt?
I'll second that. And I would say, engineer, would you care to comment on that, just to give a little bit of background? No, you can just hit the microphone right there. We'll let you.
It's not green.
Hit that,
hit-
press the button at the base. There you go.
It's green.
There we go.
Thank you, Commissioner Hamercheck. This is a little bit later than usual. A lot of things are later this year to authorize the final applications for these two projects. I will note these are reconstruct streets, which gives a much longer lifespan because they were farther down the list in terms of road condition. Our CPR program recommended these two roads. We'll be bidding them together for economy of scale, and it represents about $1.1 million from the engineer's budget, and that will allow us to garner approximately $700,000 in OPWC grant funds. Thank you.
No, thank you. This was part of the promises made, promises kept. We've been working very diligently the last few years to get our roads to be in the best shape they've been in a long time. So we thank you for the diligence there. And thank you for the tutorial on turning the button green. Okay, got to have a little fun with this, right? Oh, I'm not allowed to be folksy. Sorry, I'll stop now. Any further discussion?
None.
None being heard. Madam Clerk, roll call, please.
Commissioner Serino?
Yes.
Commissioner Young?
I think we may have lost.
Commissioner Young, you with us?
He said he had a hard stop.
Ron, did you bail? I see the line's still live. Deferring to legal, okay to proceed with 2 votes?
Still have a quorum. You may proceed.
Thank you, sir. My question to legal, I don't know if that was on mic. I was asking if we could proceed with 2 votes. Madam Clerk?
Commissioner Hamercheck?
Yes. Legal, it's okay to leave the line live just in case Commissioner Young rejoins us?
Yes, that'd be appropriate.
Thank you, sir. Madam Clerk, go. I'm sorry.
Resolution authorizing the Lake County engineer to prepare and submit an application to the Ohio Public Works Commission, state capital improvement, and/or local transportation improvement programs, and to execute an OPWC agreement for the County Line Road Reconstruction Project, Phase 1 in Madison Township.
Move to adopt?
I will second that. And discussion, engineer, are we doing this also in partnership with Ashtabula County?
This section.
Oh, your mic, sir. Sorry.
Commissioner, this section is the Lake County section. It's further north from the Ashtabula section that they maintain. So this is exclusively a Lake County project.
So, and just for those who may not be familiar, there's one section of county line that is a Lake County side by agreement. The other section is Ashtabula County. It's not split down the middle. It's more of a north-south responsibility. Am I correct on that, sir?
Yes, sir.
Very good. Thank you. Further discussion?
None?
Madam Clerk, roll call, please.
Commissioner Sereno.
Yes.
Commissioner Young. Commissioner Hammercheck.
Yes.
In the Utilities Department, resolution certifying unpaid sewer and water sums and administrative charges to the Lake County Auditor.
Move to adopt?
Second. Discussion? None being heard. Madam Clerk, roll call, please.
Commissioner Sereno.
Yes.
Commissioner Young. Commissioner Hammercheck.
Yes.
In Job and Family Services Department, resolution authorizing the execution of Amendment Number 1 of the Data Sharing and Confidentiality Agreement between the Ohio Department of Job and Family Services and Local Workforce Development Area 5.
Move to adopt?
Second. Discussion? None being heard. Madam Clerk, roll call, please.
Commissioner Sereno.
Yes.
Commissioner Young. Commissioner Hammercheck.
Yes.
In the Commissioner's Office, resolution authorizing acceptance of a VOCA grant in the amount of $244,403.45 and an SVAA grant in the amount of $18,168.08 from the Office of the Ohio Attorney General under the Ohio Crime Victims Assistance Grant Program for the Lake County Prosecutors Victim Assistance Program effective October 1st, 2020 through September 30th, 2021.
Move to adopt?
I'll second that. And discussion, Jason or Dave, did you want to comment on that?
I would just
background?
say this is an annual grant, Commissioner, and it helps us fund our Victims Advocacy Program to provide the services that are, quite frankly, mandated by Constitution and very important to these victims of crime.
Thank you, sir. Jason, did you have any additional? Very good. If there's no further discussion, Madam Clerk, roll call, please.
Commissioner Sereno.
Yes.
Commissioner Young. Commissioner Hammercheck.
Yes.
Resolution approving an enterprise zone agreement between Preston Products LLC, Nias Realty Holdings LLC, and the City of Willoughby, under which Preston Products agrees to establish, expand, renovate, or occupy a facility in the Lake County Enterprise Zone and hire new employees or preserve employment of existing employees in return for certain tax incentives specified in said agreement, 50% real property 10 years, create 5 to 10 jobs, relocate 41 jobs.
Move to adopt?
Second. And discussion, Jason. I know there's an awful lot of words here, but there's a very simple explanation for the background.
Yeah, Commissioners, thank you. The City of Willoughby and the Commissioners, we approved this enterprise zone agreement a couple weeks ago. If you recall, maybe a year ago, there was a similar deal in Willoughby where the companies essentially created a different holding company. So really, this is just a minor amendment to the paperwork based on the company's kind of business, transactions, if you will. There's nothing that has been changed from the original approval of about 2 to 3 weeks ago.
Terms are totally
That's
repetitive.
exactly correct.
Gotcha.
And this, the City of Willoughby passed their side, I believe, Tuesday, worked with the port, and turned it around to get on your agenda for this morning. Thank you.
Very good. If there's no further discussion, Madam Clerk, roll call, please.
Commissioner Sereno.
Yes.
Commissioner Young. Commissioner Hammercheck.
Yes.
Resolution awarding a bid contract to Lake County Council on Aging to administer and manage a non-medical in-home program for adults age 60 and older for the Lake County Board of Commissioners.
Move to adopt?
Second. And I believe we have Joey Tomsick in the audience. Joey, would you care to give us some background under discussion, please?
Thank you, Commissioners. Really appreciate this opportunity to be here today, and great news with the award, the bid contract going to the Lake County Council on Aging. A little bit about this program. This service provides in-home care services to income-qualified older adults that are 60 years of age or older living in Lake County who are not eligible for traditional Medicaid-based programs, but also can't afford to pay privately for the personal care that they need. So with great appreciation to the Board of County Commissioners and of course the taxpayers of Lake County, with the passage of our senior services levy, we were able to bring this program to the forefront this past year. We got sidetracked a little bit with COVID, and but the program has been off to a good start, and we expect it to really grow and flourish over the next year. I've got great appreciation, though, to a couple folks that I wanted to mention today. Aaliyah Barajas from the Senior Services here with the Commissioners Board. Obviously, our County Administrator, Jason, and Mike Mattis, who worked side by side. A lot of discussion and negotiation that went on, along with Debbie Holland from our office and Danielle Phillips. And together we came up with a great program, and we look forward to bringing this to the community once again.
Mr. President, I have a question.
Sure, please.
Joey. So I just want to make sure everybody understands the qualifications
Sure.
to participate in this program here. So if you're not, if they don't qualify for Medicaid because they probably have assets and other things that would keep them from doing so, correct?
Right.
So other than that, what is how does a couple, let's say, living in assisted living or living at home, what are the requirements that they have to meet in order to participate?
There are a set of eligibility guidelines that our manager of this program, the non-medical in-home care services program, can go over individually. It really does change from family to family, and a lot of circumstances that play into that role. So the best...
Asset or income-based?
It's a little bit of both, actually. So if they're not able to pay privately for that in-home care service, we're able to now provide this, with actually what it amounts to is a 2-hour visit from one of 3 contracted providers.
Okay.
So the best bet to answer your question, Commissioner, I would say for people to visit our website, the Council on Aging, which is lccoa.org. That can connect them directly to Danielle Phillips, or to call her directly at 205-8111.
And what kind of services, Joey, are they? Is this visitation? Is it just keeping people company? Is it doing chores for them? What?
It really has to do more with personal care services, everything that could be from perhaps some laundry services, perhaps really maintaining a sanitary environment for the senior, but then right up into providing a bath even. So, and that's been a great part of this program.
Okay, real news stuff.
All right, thank you very much.
Okay,
You're still live with me.
Sorry. Right ahead.
he's back.
I believe Commissioner Young has rejoined us. Joey, hold on, don't run away now. Okay, so the public, when they look over resolutions, they don't always get all the backstory. Just
Yes.
briefly, if I could, let's see, we have an agreement that's going to be awarding a maximum of $393,350 to the Council on Aging. We've got $351,000 of that reserved for delivery of direct services to eligible seniors. I think the public has an interest in what kind of dollars are assigned to these types of agreements.
Great.
I want to commend you and our team for the negotiations. I know there were some sharpening of pencils and some explanations that had gone on, and a lot of good hard work. So it's always good to know that the public should have a good sense that they're getting value for their dollars. So I thought it was appropriate to get those get those numbers out there. Is there anything you want to add to that? Jason, did you want to add to that?
Briefly, not to be late.
No. Jason Boyd, our county administrator.
I think it's important to know that, and Joey thanked the public, and I ditto that for the levy that we have on the books, but this was one of the projects that was identified in our initial analysis of the levy in 2015 as a gap, a significant gap, along with APS under Mr. Badiato's shop, and public transportation to senior centers, senior home repairs, and the Guardian program, all 4 pushing 5 programs that were clearly identified, the public spoke, and we are now funding and will continue to do so. So thank you.
Indeed, thank you. Thank you, Joey. Anything else you wanted to add to that, sir?
No, I would just, if I may, take a moment and just talk in general.
Oh, please,
The Council
yes.
on Aging has continued to serve our seniors. We've seen about between a 30% to 35% increase in the number of seniors that are reaching out for mostly our meals program, our nutrition program, and we have a great number of staff and our dedicated volunteers who every week are doing this incredible service to our community, Mondays, Wednesdays, and Fridays, delivering these meals to isolated seniors. And I can tell you that it's much more than that meal. And oftentimes, it could be once a week, for instance, where we do that knock on the door and the senior doesn't answer. And so we're there at the right time, the right place. We're able to contact our sheriff's office or the local police authority and help the senior out. So just during these, really tough times, we continue to serve our senior community.
Good to know. Would you be able to stay with us maybe in the second public comment portion? We could go into that a little bit more, perhaps?
Absolutely.
Do you want to add?
I just have a quick
Sure. No, good.
observation, Mr. President. Talking about seniors, Joey, our senior centers have been closed. And my wife and I were walking in the mall yesterday for a little bit, and we ran across a group of 12 people who were playing chair volleyball, a game I haven't mastered yet. Turns out that I knew a couple of them, although I couldn't recognize them easily with masks. But they were all from the Mentor Senior Center, and they were saddened that the center's not open, but they were not going to be deterred from camaraderie and a little exercise, probably very little exercise, but some exercise. So I think it's great to see that our seniors are figuring out how to deal with and adapt to changing circumstances and not just sit idly by and unattended to. So I think we in this county have a great responsibility to make sure that we are engaging our seniors in every way possible, given the circumstances that we have. Thank you, Mr. President.
Thank you, sir. Joe, if you could stay, we'll engage that during the second public comment section.
Okay, sure.
Okay, thank you, sir. Let's see, I believe we still have a vote pending on this. Madam Clerk?
Commissioner Sereno.
Yes.
Commissioner Young. Commissioner Hammercheck.
Yes.
Yes, I had my phone on vote. Give me a yes on that.
Okay, noted.
Yes.
Thank you, sir. Duly noted.
In the Finance Department, resolution approving payment of bills as listed on the Commissioner's Approval Journal in the amount of $2,030,504.63.
Move to adopt.
Second.
Discussion? None being heard. Madam Clerk, roll call, please.
Commissioner Sereno.
Yes.
Commissioner Young.
Yeah.
Commissioner Hammercheck.
Yes.
Resolution approving purchase orders as listed on the Commissioner's Purchase Order Approval Journal in the amount of $613,271.62.
Move to adopt.
Second.
Discussion? None being heard. Madam Clerk, roll call, please.
Commissioner Sereno.
Yes.
Commissioner Young.
Yeah.
Commissioner Hammercheck.
Yes.
Resolution increasing appropriations for various non-general fund accounts.
Move to adopt.
Second.
Discussion? None being heard. Madam Clerk, roll call, please.
Commissioner Sereno.
Yes.
Commissioner Young.
Yeah.
Commissioner Hammercheck.
Yes.
Resolution transferring cash and appropriations within various general and non-general fund accounts.
Move
First to
to
adopt.
second.
Discussion? None being heard. Madam Clerk, roll call, please.
Commissioner Sereno.
Yes.
Commissioner Young.
Yeah.
Commissioner Hammercheck.
Yes. Okay, this brings us to our departmental reports portion of our meeting. Usually when our engineer's here, we tend to give him the microphone. Is there any updates or anything you care to share with us, sir?
Sad note, we did lose a department employee to COVID this past week, and we've seen an uptick, so our department is doing everything that we can, cleaning especially, and consolidating operations to make the cleaning more successful, trying to put employees in individual vehicles at this time, which was the health district's recommendation relative to the spread of the virus. So it's a dynamic situation, and we are adapting as best we can.
Thank you for that update. Our prayers and thoughts go to the family and to your department, sir.
Thank you.
Any further for our engineer? Okay, let's see. County Administrator Jason Boyd, do you have anything else you want to add, sir? Indicating none. And Madam Clerk, you are up. Do you have anything for us today?
Yes, I just wanted to mention that next week, Thanksgiving week, our commissioners' meeting is going to be held on Tuesday, November 24th at 10 a.m.
Thank you, ma'am. Legal.
No reports, Commissioner.
Thank you, sir. Okay, this brings us to the old business portion of our meeting. Do we have any old business? No. Hearing none, moving on to new business. Do we have any new business? Again, hearing none. Okay, moving on to our second public comment. Jason, do we have any electronic comments? Jason is indicating none. Joey, under public comment, figure while we got you, do you mind kind of coming up and joining us? Now, Council on Aging, you've been dealing with this COVID crisis just like everybody else, and we're trying to maximize our delivery model, and I may get the terminology incorrect, so bear with me if I goof something up here, set me right. So counselors, service workers, social workers.
Social workers?
So I understand you've had to lay some off, or there's some balance or redistribute. But what I'm hearing, though, you're still getting hit with an awful lot of calls for service. Mm-hmm. How is that working out? That's got to be stressing the workers that you do have.
Oh, it certainly is. You know, we had to think creatively and strategically early on to be fiscally responsible for the efforts that we do to serve our senior community. So yeah, there were a few that had been laid off early on, still are, but the way that basically the service works is that if we get a call in from a new individual seeking services from the Lake County Council on Aging, they'll be assigned to a social worker to do an assessment over the phone. Now, just recently, we started to open up the in-field assessments. So our social workers that are still on staff started to basically follow up with those that originally were just phone assessments and started to do in-person appointments. Just this morning during our management call, we're starting to rethink that process, at least for a short term, kind of following along the lines of what the county is doing with some of their work right now. So that 30 to 35% that I talked about earlier have been individuals that have reached out to us, and they've received phone assessments, and then the service of the meal, or let's say if it was the homemaker service, was beginning shortly after that assessment.
Now, with that said, the funding structure from our seniors services levy is reimbursement based. Mm-hmm. We don't know what senior centers are going to look like. We're not even sure what your organization is going to look like. Again, post COVID, would there be, again, since you're reimbursement based, and we appreciate being sensitive to budgetary limitations and money tightening, but since there seems to be a demand for your service, would there be some wisdom in perhaps bringing back some of those social workers? Is that a possibility?
Oh, it absolutely is. In fact, we had just had a little conversation with our manager of the social work department to talk about that. And we were in the midst of those conversations when the news broke this week from the governor's office to just take maybe a pause from actually following through with that just yet. Right now, I think that if we do make some temporary changes, it would be probably about a 3-week period before we would start to look at bringing back some of the social work staff, that type of thing.
The reason I ask is our medical professionals, again, we're seeing experiences with the hospitals where they had lost a lot of staff that when they throttled back, the part-timers, they found other positions with other healthcare providers. Many of our staff, they're finding, I believe they're calling them travelers now. They're actually leaving the state. I can only imagine the demands on your services are only going to go up.
Oh, yeah. I mean, we're seeing it, certainly our social workers that are, on staff now are carrying large cases of seniors, so they're doing a great job. But I will also mention that workers in all of the other departments, our 5 nutrition sites, for instance, hard-working individuals that are there at 6 in the morning to meet the food delivery and start to prepare that food. Not even, I could not forget our volunteers, who are out there each and every day helping us in different ways. One of the things that has been really a great opportunity for our community has been the mailing of the Bridge newspaper. Because of the closure of the senior centers, because many of the outlets that the newspaper usually was distributed through, some of the local grocery chains and donut shops like, well, I won't mention any, but some of my favorites out there, but they don't want the newspapers in their lobbies any longer, just for now. So we turned to the Board of Commissioners to see if it would be possible to mail the Bridge. And so the last 3 issues were mailed to over 53,000 senior households in Lake County. And it's been a great outreach tool because it not only educates individuals about the seriousness of COVID affecting seniors, but it also talks about services that are available through so many of our partners and collaborators within the community. And it's been great, and we look forward to, in 2021, continuing that. And we're probably looking at an area within our levy application to look for funding that can make that possible now, because we've received so many good comments from seniors in the community that some of them never even knew we had the Bridge newspaper. It was unbelievable. Others that, thanking us for giving them a tool now to touch base with some resources that they hadn't known about. So I thank you again for that, too.
No, we thank you for your efforts. Don't be a stranger.
You bet.
This is, again, we try to get as much information out to the public, and this is probably a good opportunity if you could join us at meetings or over the phone or by electronic. I'm reticent to be saying Zoom or WebEx and all these other things. There are all these brand names, but we'd love to have you back, and we could talk senior issues. I think that's becoming very relevant. We're hearing more and more questions, so more and more answers, I think, would be a good thing. So with that, thank you so
Great.
much. Appreciated for your time.
I'll bring my button box.
Yes. He's quite the accomplished accordion player.
Well, I broke your...
Oh, way to go. Nice. Jason, is this under warranty? I'm being folksy again, sorry.
Charge the Council on Aging.
Oh, there's that charge back. Oh, boy.
That's right. Time for an allocation.
All right, well, this concludes our public comment portion. We do have a request for executive session. The purpose would be real estate disposition. There will be no further business to be conducted afterwards. With that, do we have a motion to adjourn?
Have any other?
Just to verify, you have no other, okay, just confirming.
So moved?
Second.
Very good, moved and seconded. Discussion? No further discussion. Madam Clerk, roll call, please.
Commissioner Sereno.
Yes.
Commissioner Young.
Yeah.
Commissioner Hammercheck.
Yes. Thank you for joining us today. This meeting stands adjourned.